from 2D OPG imaging. During the presentation, I'm going to show you different capabilities of DiagnoCAT, as I mentioned. And starting from OPG, we have also a new product, which I'm going to mention at the end as White DiagnoCAT. And also, I'm going to mention about the intraoral X-rays and also the CBCT imaging. So on the screen, you can see different kind of pathologies that can be detected with the DiagnoCAT, starting from periodontal bone loss. Either we can diagnose mild, moderate, severe, horizontal type or vertical type, and also we can diagnose the pathologies of the teeth itself. Of course, if you have a new patient, as all we are doing as dentists, after the systemic evaluation, systemic disease evaluation of the patient, the first thing that we are doing, just checking in the intraorally, what is missing there, what is not missing there. So in the DiagnoCAT, especially in 2D and also in 3D as well, we have a radiology report that is starting from the tooth numbering as well. When you feed the OPG onto the DiagnoCAT, you can see what is healthy, what is missing, what is unhealthy, and what should be concerned. And not just only showing, but also giving a report to you. Especially, this is quite important because as dentists, we are always telling to our patients what is missing there, what is a pathology and so on. But most of the patients, they don't understand what we are talking about. But when you show as a dentist, especially using the AI modalities, then they will start to recognize what is the problem indeed. In the panoramic report from the 2D imaging, we can also detect not just the periodontal bone loss, as I mentioned, the artificial crowns, and also the endodontic, the threaded tooth as well. What we can achieve from 2D report as well, the adequate obturation, whether the root canal treatment has adequate obturation or not. This is an additional decision support system for the dentist because sometimes as dentists, we may miss the adequate obturation of the teeth root canal, as well as we can miss the root canal morphology as well. Let me show you a couple of examples for this. Here is an OPG, and from the OPG, we can see that the root fragments here, and also we can see the impacted teeth. And also, we would like to check the periodontal bone loss. For instance, at the tooth 47, the DiagnoCAT mentioned that the tooth has periodontal bone loss, furcation lesion, and dental calculus as well. But what can be missed, actually, it is a short filling and also a periapical radiolucency. Most of the time, in the molar region, especially in the mandibular molar region, we have submandibular fossa. So because of the superimposition of the submandibular fossa, the very early beginning of the periapical radiolucencies can be missed. So with the DiagnoCAT, we have capability to diagnose them as a decision support system. Here is a CBCT reconstructed OPG. As I mentioned, the models on DiagnoCAT can accurately indicate the tooth and the numbering of the tooth as in this example. So see how accurately it was diagnosed from an OPG, the reconstructed OPG from CBCT. This is quite important because in 3D imaging, as a radiologist, if you give me a volume, I have to do it by myself using a couple of programs and drawing the curve and so on and achieve the OPG. But right now, we don't need to do anything at all. The DiagnoCAT is just like doing for you, and the AI modeling is doing the best curve and having the OPG and the tooth numbering instantly from the 3D volume. I was mentioning about the dental morphology. Actually, I'm pretty sure that we have these types of patients. The patients, you are doing the root canal treatment and so on, and you're sending the patient, and the patient is just coming the other day and saying that I have pain and so on. And most of the time, the pain is related with a missing root canal. But right now, we have capability to diagnose the external roots and to visualize the root canal morphology precisely, not just from 2D imaging, but also from 3D imaging as well. Here is an example for this, a CBCT volume, the OPG reconstructed from CBCT, and you can see the morphology was given by the DiagnoCat as a report to the dentist. Another example for this, again a CBCT volume, that was the OPG reconstructed from the CBCT volume. And you can see the morphology, the number of the tooths, 3 roots, 4 canals, size of caries, and so on. And there were too many information just from the volumetric imaging of the CBCT. We can also predict here the caries lesion as well, which I'm going to mention in a while. So, as all of you know that the dentist mostly challenging with the caries detection. The caries lesion is the most chronic disease is all around the world. Is right now 2 billion people are affected, and we are responsible to detect the caries and also make the caries lesion. But most of the time, we are missing, especially the very early caries lesion from the enamel. Even if you are probing these types of caries lesion, you cannot see it even with the probing, even with the clinical examination. And the most relevant radiography modality is the Bite-Ring radiography, and it can be missed as well. But right now, together using with the AI algorithms and in DiagnoCat, it can be diagnosed instantly and it can be segmented from 2D images. And the DiagnoCat is giving as a report. Now think about this. How cost effective is this? If you miss some kind of like caries disease, so your patient is just going to return back and then the caries is progress and you need to do more and more the treatment. But in the first hand, if we can diagnose in the early, we can prevent the caries lesion. Not just from the intraoral, but also from the OPG. The 2D OPG from the DiagnoCat algorithm indicated the caries lesion here. As you know that diagnosing the caries lesion on OPG is a little bit challenging because of the superimposition and the magnification. But together using the AI models and also DiagnoCat, now we have another decision system that gives you all the report and also the signs of caries detection. So, as I mentioned, it's not just only the 2D modality. Nowadays, we are using DiagnoCat from 3D modeling as well. So normally, the CBCT has huge challenges in order to detect the caries lesion because of the technical limitations, because of the artifacts in the CBCT, such as beam, such as scattering, such as blooming artifact, and so on. But right now, together using with the AI modeling, now we have another opportunity and another tool to correctly diagnose the caries lesion from CBCT. I'm just going to show you an example. This is OPG reconstructed from CBCT, and as you can see, this caries lesion, and this caries lesion is diagnosed quite nicely and correctly from the CBCT image. Of course, still we have limitations. So we did a couple of research about this, and we created in DiagnoCat to diagnose especially the secondary carious lesions from the CBCT imaging. If I'm lecturing this webinar, these presentations like a couple of years ago, I will tell you that please try not to make any diagnosis, carious diagnosis from CBCT because of these artifacts. But right now we are using AI models to reduce the artifacts, to erase the artifacts of the CBCT, and we can figure out especially the secondary carious lesion and the carious lesion out of CBCT volume. So right now, there's another option and also tool for carious diagnosis. All right. The third issue, especially as a dentist, we are face to face with the periapical pathologies. So there are too many reasons for the periapical pathologies, but to diagnose the periapical pathologies are quite important because, especially using 2D imaging, it can be misdiagnosis because of the superimposition and the magnification, and also it can be misdiagnosis due to the technical limitations. But as you can see here, the DiagnoCat gave you all the reporting here and indicated here is an artificial crown and we have periapical radiolensis here. So it's warning the dentist that be careful, this may be a periapical pathology. All right. Not just from the 2D imaging, but we are using DiagnoCat from the 3D imaging modality. We performed several scientific studies using DiagnoCat, and we figure out that the reliability of correctly detecting a periapical lesion is more than 90% in DiagnoCat. So as you can see, it can do the segmentation correctly over 90%, and not just make the segmentation, it can calculate the volume of the pathology. Now think about this. You are talking with a patient and you are saying that, oh, you have periapical pathology and I need to do the root canal treatment and so on. But when you show the patient this periapical pathology in a 3D fashion like this, then your patient start to understand what you're talking about more. You can follow the patient in 3D fashion and you can make the fusion and you can say that here is your pathology and after the treatment it disappeared, it diminished. Not just only for the dentist, but the patients can start to understand the pathology and also the treatment. So another capability that the DiagnoCat can do is to detect the periodontal bone loss. To detect the periodontal bone loss in 2D fashion is quite challenging though. If you have even 3 volt pathologies periodontal bone loss. And right now in DiagnoCat, we can just diagnose the periodontal bone loss and also detect the bone loss, and the DiagnoCat can give you a report. Not just only giving a report as periodontal bone loss, but also give a report whether it's a mild, it's a moderate, or it's a severe periodontal bone loss. Of course, not just only to the imaging. Now we have the capability in DiagnoCat to diagnose the vertical, horizontal, and 3D 3-volt periodontal pathology as in the slide. See how nicely it's segmented from the CBCT image to detect the periodontal bone loss. The capability in DiagnoCat actually is not the segmentation, only the 3D nature 3D bone, but it can give you an MPR image, multiplanar reconstruction, from the axial, from sagittal, and from the cross-section image, which may help you not just in the diagnosis, but also in the treatment of the patients as well. There are different capabilities of, also to diagnose the filling and the restorations, and also the secondary caries lesion. As in the slide, you can see a 2D panoramic imaging, which was the report was generated by the DiagnoCAD, and it's mentioned the healthy and the problematic teeth here. And from that, we can indicate the periodontal bone loss, the filling, and also you can check the other pathologies as a whole in the DiagnoCAD. Another example is the referral recommendations. I was mentioning all about the diagnosis and also the segmentation of the DiagnoCAD from 2D and 3D, but there are also referral recommendations. So the DiagnoCAD can give you about the pathology and also recommend about the referral, right? Check these teeth from prosthodontist, check these teeth from endodontics, and so on. Even if you like to see more deep in detail about these teeth, have a CBCT. So you can have these referral recommendations from DiagnoCAD. Another example that we can diagnose in 2D and 3D fashion is the impacted teeth. As a dentist, as all of you know that we are face to face with the third molars, and the extraction of a third molar is a routine for our daily practice. As in this slide, you can have like 4 impacted, but the most important thing as a dentist, we need to know if the tooth is connected or in a relation with the mandibular canal, or is far away with the mandibular canal, or in contact. Now, the DiagnoCAD can give you this prediction, can give you this diagnosis, not from 2D, but also from 3D imaging modality. Couple of papers, couple of studies we did using DiagnoCAD, and we performed actually to detect the mandibular canal and the segmentation of the mandibular canal, and also the segmentation of the maxillary sinus. And we asked DiagnoCAD in order to detect the relation of the impacted teeth together with the anatomy, which is right now over 90% is correct the diagnosis, and the DiagnoCAD can give you the diagnosis, can give you whether the extraction is going to be difficult or not. We have models for the prediction of the difficulties as well. Let me show you an example from the 3D imaging, CBCT imaging modality. So we have the volume. From the volume, the DiagnoCAD reconstructed the OPG and also reconstructed the cross-section, the axial slices, and mesodistal slices as well. The mandibular canal or the nerve is just segmented automatically, and we can follow the segmentation of the nerve and the relationship of the nerve together with the third molar or the impacted tooth. It's quite important because sometimes even using a CBCT, we cannot predict or even we cannot see the mandibular canal because of the different concavities and also because of the superimpositions fossa. Here's another case. So in this case, we can easily see from the 3D reconstruction the relationship of the mandibular canal of the third molar, and we can plan our surgery according to this. Not just only from one side, in a 3D fashion, you can all the way check the third molars and the connection of the third molars together with the mandible and also the mandibular canal. Here's an example for both mandibular nerve and the maxillary sinus as well. So the third molars are not just only related with the mandible, but also it can have relationship to maxillary sinus. See how nicely the teeth are segmented and also the maxillary sinus. What you can achieve the complete bone. You can erase the bone, just see the mandibular canal, and also you can play with the threshold, and you can play with the transparency, and you can see the maxillary sinus together in relationship with the third molar. So see, we erase the maxillary sinus and the maxillary bone, and we can check the connection of the teeth together with the maxillary sinus. It is quite important because not just only the complications can be due to the mandibular canal, but also can be due to the perforation of the maxillary sinus. Now we have the capability to check the teeth and relationship of the maxillary sinus in a 3D fashion. Again, not just only from one view, but we can also check from all around the view, from buccal, from palatinal region, and also we can check the vital organs, vital anatomy in a 3D fashion. Let me show you a couple of examples again from the impacted teeth as well. Here is a CBCT volume, and the CBCT volume, the OPG was reconstructed from the CBCT volume, and there is an impacted 38 here, and we would like to know about the connection between the teeth and the mandibular canal together with the 48. Now, check this out. The 38, the diagonal cat is saying that be careful, this tooth may be relation or can be relation with the mandibular canal. But on the other side, check the 48, it is not related. So this is how nicely being told you as a decision support system by the diagonal cat. So you can predict the difficulty of the extraction. Another example, and see in this example, we can check actually in this example, the 38 may also be related with the mandibular canal. As you can see, it's like impacted, but there's no 48 at all. All right, let me give you another example for this. There is a beautiful 3D reconstruction of the molar. And from this to the reconstruction of the third molar, you can see there is not a relationship between the mandibular canal and the roots. But what is missing in the 3D? We missed here the caries and the dental calculus. See? And as I mentioned, not just from the 3D reconstruction, but we can check it out from sagittal, frontal, axial, cross images. And the diagonal cat is telling you this is a sign of caries lesion as well. Now I'm going to show you a very interesting case. So just check it out, the green segmentation. So this patient referred us for the extraction of the third molar. So I was just checking from the CBCT volume, and I thought that, yeah, this is not in relationship with the mandibular canal and so on. But what I did, I fit the CBCT volume with the diagonal cat, and I made the 3D reconstruction of the mandibular nerve. So now see, there is a disturbance on the mandibular canal, which I didn't recognize in the first time from the CBCT image. When I saw this 3D segmentation of the mandibular nerve, I thought that there is a discrepancy. There is some kind of a disturbance on the mandibular nerve. Then I get back and do additional radiography, and this patient was turned to a schwannoma case, which is very rare in the mandibular canal. So even as a radiologist, I missed it from a regular CBCT imaging, but with the diagonal cat 3D segmentation, I figure out there's some kind of a disturbance on the mandibular canal. So this is the cost effectiveness. Now think about this. If I'm just going to play around, if I'm just going to extract the teeth without knowing this tumor, is gonna be huge, challenging, and we will need additional treatment for the patients. All right. Having said that, let's jump to the cephalometric analysis and the
Dr.
orthodontics
Khan,
as well.
sorry for interrupting you. May I ask
Yes,
you to hide the video because it makes the schedule.
sure.
Thank you.
Let me open and yes, close and hide the video. Okay, I hope I hide the video. So let's continue with the cephalometric analysis and in terms of the orthodontics. In DiagnoCat, we can diagnose not just from the 2D imaging, but also in 3D imaging fashion as well. So see, from 2D imaging, we can diagnose all the landmarks and everything related to the orthodontics, and the DiagnoCat can give you all the landmarks and the measurements, linear and angular measurements simultaneously. Not just from the sagittal, but from the anterior as well. So we can see whether it's skeletal class 1, 2, 3, maxillary anterior position, protrusive, and so on. It is automatically done by DiagnoCat. Not just from the 2D, but from the 3D imaging as well. So see the segmentation of the teeth, the landmarks of the teeth, even the Pons analysis, the Bolton, the space, the crowding, and the curve of space can be diagnosed and measured automatically by DiagnoCat. So in the 3D self, we can also compare the initial, the final, and also we can follow up our patient. As a dentist and also as an orthodontist, we can also play around with the teeth and we can also adjust the teeth in terms of how to make the occlusion in a way that is sufficient for the patient. So here is the initial phase, and we can compare the initial, the final, and the both. And what we can compare, especially the occlusion as well. See, we disappeared the maxilla. Right now, we can see the occlusal points of the mandible as well. This also gives you another insight about the occlusion, not just for the orthodontics, but also prosthetic rehabilitation as well. We can also detect the fenestrations and the dehiscence due to the orthodontic application. See how nicely the dehiscence and the fenestrations on the bone can be detected by the DiagnoCat itself. All right. Another capability to use, especially for the cost-effective treatment, is the endodontic report. So from the CBCT volume and also 2D, we can extract the information in terms of endodontics. See, this is the root canal space and the root canal system. We can exactly show our patients, and also as a dentist, we can detect access to our canals here and reshape or orientate our treatment modality according to this report. Not just only from the slices, but see, we can nicely segment the periapical pathologies, and together using with the threshold, we can see the relationship between the anatomy. As I already mentioned, we can not just see from the 3D, but also in an MPR facial from axial, sagittal, and the trough, and we can check the relationship, especially for this patient, the maxillary sinus relationship between the periapical pathology. All right. Here's another example. In this example, we have root canal treatment, and we can see if the root canal treatment is adequately filled or not, or it is all the way any root canal anatomy was missing for the treatment of the teeth. As I mentioned, the patients can come to you and they say that I have pain and so on. And right now we have a decision system to follow all this. See how nicely the 3D segmentations were done due to the periapical pathology. At C, there is a huge dehiscence and also opening of the maxillary sinus. It is quite challenging when you are looking from the 3D volume, especially if you are not orientated, you can miss these types of fenestration and also relationship of the openings of the maxillary sinus due to the periapical pathology. But right now, we have this option to visualize everything. Of course, I was showing you all the teeth for the adult patients, but we are using for the deciduous teeth with the unerupted teeth as well. So see, this is how nicely segmented the third molar. Different kind of AI algorithms can predict actually the unerupted tooth and also can give you such as the formation of the root, and you can also predict the age. You can use as a forensic medicine tool in your daily practice as well. Another scientific study that we have done using DiagnoCat, actually, we made the segmentation all this craniomaxillofacial anatomy as I already showed, but what we did, we also detect the pharyngeal airway in obstructive sleep apnea patients. In dentistry, we have these types of patients which we need to know the airway volume and also the minimum and the maximum area. See how nicely segmented by the DiagnoCat in 2D and 3D format the airwaves and also calculated. So as a dentist, we can have this information and we can forward this information to an ENT doctor or in a medical profession in terms of airway obstruction. Another capability that we can use the DiagnoCat is the temporomandibular joint. From the CBCT volume, we can make the segmentation all the way sagittal, coronal, simultaneous, and also automatic segmentations. See how nicely all these segmentations done for the temporomandibular joint. For the 3D fashion, so we have this CBCT-based AI-generated STL files in diagnosing osseous changes, especially in the mandibular condyle. So for these types of segmentations, right now we have the capability to see the surface of the temporomandibular joint using the DiagnoCat, and we can diagnose flattening, erosion, osteophyte formation, osteosclerosis, and bifid condyle formation with a Kappa value 1, which means that it's 100% diagnosis, which we achieved with the DiagnoCat. Let me show you a couple of examples for the 3D representations. From these 3D representations, we have the temporomandibular joint condyle. See the posterior part of the joint is how nicely segmented by the DiagnoCat. Lastly, I would like to also show the thresholding. Right now in DiagnoCat, we can change the thresholding for the restorative, for the endo, for the perio. See, when you click on restorative F endo, the thresholding and the mask is changing simultaneously, and you can see where is the root canal, where is the teeth, and also the caries. And we can, if you click on the perio, you can also calculate automatically the periodontal defects, and also the measurements can be given by the DiagnoCat automatically. We can also use for the dental implant planning as well. So in the dental implant planning, we can do CBCT volume, the OPG reconstruction, And the DiagnoCAT can accurately measure the width and the height of the anatomy that we are just going to place the dental implant. Of course, if you are working with the 3D, we can see not just only the teeth and the periapical lesion. See, the dental implants are also segmented nicely as an artificial material in DiagnoCAT. I'm not pretty sure that how many of you are using guide planning from CBCT, but right now we have on DiagnoCAT the capability to make a fusion together with the intraoral scanning, and also we have capability to design the guide simultaneously. Now I'm just going to show you a real-time design of the guide. So see, here is a volume 3D imaging modality. So we fed it the CBCT and we are just checking which place implant are we going to perform. In this example, it's like 36 and 46. So for this example, we have a library. From the library, you can select the manufacturer, the type, diameter, and length. That's it. All you need to do, you need to place the implant in a precision, in a precise area from axial, sagittal, and cross. Just fit in the mandible for this case, or just fit in the anatomy. Then, if everything is okay, just choose the sleeve that you're just going to use for the guide and approve. And you will click on the generate the surgical guide. Now, this is real time. So as a radiologist or as a dentist, if you give me these types of CBCT volume, and if you ask me, plan this guide, it will take my at least, I don't know, like half an hour or 1 hour to diagnose, because I need to segment all the teeth, I need to say all the anatomy, put the implants, and so on. Even if it's manual segmentation of the tooth, it will take my entire day. But see, right now, all I am doing is approve the tooth and generate the guide itself. See, it is automatically fusion a surgical guide model here. If you have a 3D printer, you can approve it. You can download your STL and send it to your printer. Within 5 to 10 minutes, you have your surgical guide using DiagnoCAT. One of the last things that we made as modeling is the automatic pulp segmentation from the CBCT imaging. See, these segmentations are done from 100 microns from CBCT imaging. Not just only the structures of the teeth, but also you can see the root canal and the variations of the root canal. And see how nicely you can see the variations of the root canal, even very close to like micro CTs. Again, the technology, when it's going a little bit further, we can go down to 60 micron, 50, 60 microns of CBCTs, then you will achieve these beautiful segmentations of the pulp. And while doing like root canal treatment, it will be very beneficial for the dentist. Lastly, I would like to mention our White DiagnoCAT product. Actually, I will just show a glimpse the White DiagnoCAT product, not just from 2D, but also Pano, but also 3D imaging. You will just upload your pictures, your X-rays, and you can click on the anatomy, and all the anatomy is segmented all the way from pulp to enamel dental structures. And when you click endo, resto, perio, then it will pop up, the carious lesions pop up automatically. The perio and the other pathologies are pop up automatically together with the report actually. So this ViteAgnaCat product is just going to be released depending on the countries that you are living. So feel free to get more information about your country representative. So as the last slide, if you would like to contact with us, and if you'd like to get more information about the DiagnoCat product, please scan the code and we will be very happy to help you in any way. All right. So thank you very much for listening me.
Thank you very much, Dr. Khan. It was amazing as usual. And I would like as well to thank our guests for their attentive listening. And I hope that they have heard something interesting for them today and something which make them use AI in their dental practice daily, because AI is future of any industry and dentistry is not an exception, right? So I would like also to underline that DiagnoCat is a medical device, and you should specify in your countries, in your country representative whether DiagnoCat is available or what version of DiagnoCat is available. So sooner or later, 2025, all the features which are demonstrated today, I hope will be available. So I'm resending again the link for you to meet the DiagnoCat team if you arrived later. It is in the chat. You can book a demo with my colleagues and they will be more than happy to walk you through all the features again and give you all the necessary information. As well, I would like to invite you to the next DiagnoCat webinar, which will take place in November. This will be a web talk between a general practitioner and dental technician, Christian Leonhardt and Dr. Roland Kiss. So I'm also sharing the link. You can register right now to the webinar or just follow our emails where we will be inviting you. So let's see whether we have questions. At least I can see one. I will read it aloud. So the question is, dear Dr. Khan, thank you for your presentation. Is DiagnoCat has the capability to measure the working length for endodontic treatment?
As I already showed that with the DiagnoCat product and also this 3D segmentation, we will for sure release the working length for endodontic treatment soon. So you can easily check automatically the working length of the endodontics and the treatment, not just from the 2D but 3D as well, but keep in mind about the magnification and so on in 2D imaging. But for the pulp segmentation, whatever the DiagnoCat is measuring is that, so pretty much you can use it. And one more thing that I would like to mention, especially together with these types of 3D imaging modalities, right now we will have the capability to segment the tooth and the pulp and the palpation, and this may lead actually to robotic dentistry as well in the future. So this is not a webinar for like talking about this, but I would like to mention that there are a couple of companies already working on this, like mini endodontic robots and so on. What they are going to get the information in terms of the pulp segmentation will be from AI.
Okay, thank you very much. So another question to you in our chat. So Dr. Khan, thank you for your presentation. Does DiagnoCat provide an API, and in which country is the CE medical product registered?
Well, actually, right now there's a wide range for the medical product registration, but perhaps Victoria can reply better than me about this.
Yes, yes. About CE mark, we do have it in the European Union for the current version of DiagnoCat 1.0. So next year, we are expecting another update so that all the features you have seen today will be available in all the European countries. And about API, I think we should align with our R&D team, but I know that there are cases when it was possible. I think we should go into more detail. So maybe you might send me a request or use the link I've sent today so that we can discuss it in more detail, whether we can suit your expectation. Okay, do we have any other questions? Not yet. Okay. So I think we're all set. No, one more question. Have we used this software for help the treatment plan with medical history of patient?
Mhm. Well, I mean, I already mentioned one case which is quite interesting, I may say. I was mentioning about the CBCT segmentation, actually. And let's think about this. If you have a patient with the systemic diseases, let's say if your patient has a neurofibroma or which is affecting the mandible or the maxilla in terms of any kind of degeneration on the bones, if you have this information together with the bounding with our segmentation with the DiagnoCat, you can see quite nicely what is happening on the bone. And another case, let's say the patient has like rheumatic diseases, let's say Sjogren's rheumatoid arthritis. As all of you know that the rheumatoid arthritis, Sjogren's rheumatoid arthritis can be affected the TMG. So the very early changes on the rheumatoid arthritis, especially the TMG degeneration, can be misdiagnosed using a regular slices. But with the 3D segmentations, you can catch these resorptions in a way in the very early stages. So these are two examples that we can use DiagnoCats with the medical history of the patients, especially for the systemic diseases. But nevertheless, there is a huge wide variety. Remember, I showed you the case of schwannoma. I didn't even recognize from the slices of the CBCT. But when I saw from the 3D, I thought that, all right, there's something happening. Then I took an MRI actually. Later on, it was biopsy and turned out to be schwannoma. If I didn't have the segmentation, then it will be misdiagnosis at all.
Okay, thank you, Dr. Khan. And one more question. Can you tell us what is your segmentation network?
Oh, this is very technical, I must say. Of course, we need to ask. I mean, as far as I know, of course, I'm not an engineer, but we are performing different kind of networks, starting from the basics unit. We are using NN unit version 2. We are using, of course, in combination fusion of these types of models. This is very technical, but all I can say that we are using different kind of networks for different kind of modeling, actually. But if you'd like to get more information, for sure, send us an email so we can contact our engineers for this and to understand, to tell you more about the networks that we are using.
Okay, thank you very much. I think that's it currently. No more questions. Thank you very much, dear guests, again. We hope to see you at our next events with Dr. Khan and with other speakers. And we hope to see you among DiagnoCat users very soon. Thank you. Oh,
Thank you
sorry,
very much.
one more question. I use the
No.
segmentation result to work in virtual reality? Okay, what is the question itself?
Perhaps
yeah.
perhaps you would like to use if your segmentations can be used for virtual reality for sure, because I guess it was like a couple of months ago our CEO Alex demonstrated our segmentation in Google's, in a couple of Googles, and in Apple product as well, Apple Vision product as well. So what you can get in terms of segmentation, you can export it and you can use it in Oculus, in other segmentations, and so on. More, of course, the segmentations, not just only for the direct market, but segmentations can be used for the student education as well, for the student education in the dental schools as well. So pretty much you can export, and of course you can import all the segmentations on the VR. Of course, it depends what you would like to do, but you have this capability to do so.
Okay, the problem is adding the mandibular movement from the axiograph record.
I didn't get the question, but perhaps he would like to ask if it's kind of a dynamic TMG movement. And it is said that we have a technique, it's like axiograph record. This is also very technical part, but by and large, we can predict a couple of landmarks to be segmented, and we can even make the fusion for the axiograph in order to predict the movement of the temporomandibular joint. Of course, the record is another way around actually. So record, as our audience said, is a little bit problematic right now. We need to use different kind of modeling. We need to use different kind of network in order to record all this. But this is too technical part of the AI, and the registration of the axiograph also together with the AI segmentations. But they can be made in the near future.
Great. Okay, it was very active session today. Thank you for all the questions we have. If anything should be answered, please just follow the contacts on EU section of dagnacat.com or use marketing@dagnacat.com, and we will try to help you with all the answers. Okay. Thank you very much, dear guests. Thank you very much, Dr. Khan, again.
Thank you very much.
And have a nice
day.
evening. Have a lovely evening tonight.
Bye-bye.
Bye-bye.